Get started here. I'm Dr. Patel. Good to see you. Hope you all are doing well. Welcome to our Facebook Live. Today we're going to be doing a live demo of a knee ultrasound. So the knee obviously is the joint where our thigh bone meets the lower leg bone. A lot of different various injuries can occur with the knee, and a lot of different things can cause pain in one way, shape, or form. But the purpose of today is to demonstrate how I use ultrasound to evaluate the knee more as an extension of my physical examination to really determine all the things that may or may not be going on in the knee. If you like this video, if you found it helpful, please like, subscribe, all those kind of things. Share it with your friends, share it with your enemies, and if you have any questions, please comment, DM us, or you can email us at info@fxregencenter.com. So without further ado, I'm going to go over some of the knee anatomy as I go along, and I'm going to go through basically how I use ultrasound to look at the whole knee as a picture. Now, before I go on, just to kind of tell you what ultrasound is a device that uses sound waves to actually reproduce images of the inside of your body. And basically this device here sends sound waves into the body, and then those sound waves bounce off of different structures, come back to this probe or transducer, and that gets interpreted as images on the screen. And I'm going to point out what some of those things look like. So the advantages of ultrasound is that there's no radiation. It's point of care, meaning that I could do this with the patient here and show them live what's going on in their body. It actually is more sensitive than MRI for certain superficial structures like tendons and ligament structures. And we have the advantage of being able to see joints in motion. So we can actually see what the anatomy looks like when we're moving the knee around in different positions, etc., versus something like an X-ray or an MRI that's a static, single picture. So I'm going to get started with the knee here. This first image that we're looking at is actually at the front of the knee. If you can picture where I have my probe right here, this is the thigh, this is the lower leg, and this is the kneecap over here. And when we look at this image, we can see that this is the thigh bone, this is the kneecap, and this is the thigh muscle called the quadriceps, the tendon of that quadriceps coming and attaching onto the kneecap here. Just for orientation, this is towards Lexi's head, this is towards her feet, this is superficial, so the skin over here, and this is deep. Now as we go deep, we can see this bright white structure here is the thigh bone. Now we can't see anything past the thigh bone here, and we can't see anything past the kneecap over here, because this is bone, and all of the sound waves that are being sent in by the ultrasound are bouncing off of these bone structures, and therefore we can't see deeper than that. So one of the disadvantages of ultrasound is ultimately that we're not able to see deeper structures the way that X-ray and MRI and CAT scan can do. But you can see that for these superficial structures, very, very accurate, really great amount of detail that we can get from this. So when I start scanning a knee, I always start scanning at this front compartment called the anterior compartment, and I start scanning north of the kneecap, which is right here. So from here I get a good view of if there's any major inflammation that's going on inside the knee. This area higher up than the knee is actually a pocket, a window that we can look and see if there's inflammation coming from within the knee. Because when there's inflammation or swelling inside the knee, that actually can pool up here because there's a capsule or a kind of a balloon that surrounds the knee joint, and that balloon goes as high as this area over here. So when we look over here, we have the kneecap, we have the tendon of the quadriceps or muscle, and in between these two areas you see this black line that's right here. That's actually part of the joint capsule, and if this was completely black and wider, thicker, then we would say that there's some inflammation or fluid coming from within the joint. But you can see in this situation that we don't have really a substantial amount of inflammation. You can argue that maybe this is a little bit over here, but ultimately everybody has a little bit of fluid inside their knee, so I'm not overly concerned by this. Now, looking from this view, this is the tendon of the quadriceps muscle. The quadriceps is the big muscle in the front of the thigh. And the tendon is what attaches muscle to bone. And you can see the nice pattern of tendon here, kind of all lined up fibers. The way that I describe tendon is like it's the paintbrush bristles, right? The bristles of the paintbrush that are all compact, all parallel. And you can see that really quite well over here, coming and attaching all the way over to the kneecap. Now, if we want to get a better view of this tendon and where it attaches, Alexa, can I actually have you bend your knee for me? Just like that. And now we can get a great view of this tendon coming and attaching onto the kneecap over here. All right. Now from here, I'm actually going to go on to below the kneecap into what's called the patellar tendon. So the patellar tendon over here is now where the kneecap comes and meets the lower leg. Where the kneecap comes and meets the lower leg. So this whole structure right here is the patellar tendon. And the patellar tendon, again, you have the nice fibrillar linear pattern of the tendon. You're starting to see a little bit of disorganization in areas here. See these areas where it's a little bit darker, a little bit darker. These might be areas of a little bit of what we call tendinopathy. Now, tendinopathy is when the tendon fibers get disorganized. This happens, it can happen normally as we get older and as we're doing a lot of activity, or it can happen if we're not moving correctly. If our biomechanics are off, or if we had an injury at any point, then our kneecap can glide improperly in its groove and cause that patellar tendon to start having some disorganization to it. So you can see that there's these thin black lines throughout here. There might be a little bit of disorganization of those fibers of the patellar tendon. Now, I'll look down in this area over here, which is where the patellar tendon comes and attaches onto the lower leg bone. And in this area, you can see there's a little bit of black right here, but if this was a lot more black in this area, black in ultrasound, other than the black that we see past bone, black in other areas actually refers to fluid. So if we saw some black in this area, which we don't, we could say that there's some bursitis or inflammation that's going on where the tendon comes and attaches onto the bone. Now I'm going to look at this tendon in cross section here. So this is now, I changed the orientation of my probe from here to here, and this is now looking at this tendon in cross section. So this almost oval-like structure is the tendon here. You can see what a nice, beautiful tendon looks like. Overall, looks really healthy. Can't really complain about this tendon much. Now I go back over the top of the knee, and from this position, you can keep your knee flexed like that. From this position here, we now see this kind of U-shaped structure. Okay, that U-shaped structure is actually the groove that the kneecap sits in. So this bright white line is a part of the femur, the end of the thigh bone, and this dark line that we see over the white line is beautiful, nice, healthy cartilage. That is what nice, healthy cartilage looks like. And this U shape is the groove that the kneecap sits into. So as I move my probe a little bit, you're going to see the kneecap come into view here, and you can see that that's sitting nicely in this groove. Now, we can actually look at different areas of cartilage as well. So from here, when I'm scanning, I go to the medial side or the inside of the knee, and I take a look at the cartilage at the end of the femur, at the end of the thigh bone. This is the kneecap over here, and you can get a little bit of a peek at the cartilage on the undersurface of the kneecap there. And I go all the way down to the bottom of the femur, and you can see the way that I'm angled with my probe over here. I'm looking actually at the weight-bearing surface of the femur, or where that femur comes and attaches to the lower leg. Because her knee is bent, I can see that undersurface of the femur there. We get a beautiful view of the cartilage. And we could do the same thing on the other side, the lateral side, or the outside of the knee. Again, the cartilage here of the lateral femoral condyle and the patella, and a little bit of cartilage on the undersurface of that. And again, as we go down, this is more of the weight-bearing surface of the lateral femur, or the end of the femur right there. So from here, I'm going to look at a structure that a lot of you may have heard about, which is called the iliotibial band. The iliotibial band is a band of tissue, of ligament, that basically comes from the outside of the buttock and goes down the side of the leg and attaches onto the knee. It actually has fibrous attachments, the most prominent of which goes to the lower leg, but has fibrous attachments that goes to the kneecap as well. And a lot of people talk about their ITB or IT band getting tight, and people try to roll it out, foam roll it out, stretch it out. Reality is that that's not oftentimes actually getting tight, and it actually feels that way because of weakness on the outside of the buttocks. Sometimes that IT band, if it feels tight, can also cause pain on the outside of the knee. And sometimes if that IT band is actually not moving appropriately, we can actually get inflammation or irritation around the IT band. That's called a bursitis. You can also get an irritation of where the IT band attaches onto the bone as well. And it's similar to that kind of tendinopathy picture of the patellar tendon. So here is the IT band over here coming across the top, attaching onto the bone over here. And that actually looks really healthy. So as we're traveling back towards the femur, so now this is the femur, and this is the iliotibial band coming across the top here. We can follow that back over to the femur, and it's in this area over here that sometimes if we see a pocket of black, then that would be suspicious of something like a bursitis over here. And sometimes people can feel a rubbing pain in that outside portion of their knee. That could be an iliotibial band bursitis or iliotibial band friction syndrome. Now, we look over here, and this is this kind of round structure, almost kind of looks like an eye. Right? You can kind of see the eye, the pupil over here or whatnot. This eye is actually a tendon that's coming in cross-section, little known tendon called the popliteus. And this tendon actually wraps around the back of the knee and is a part of the mechanism of locking, unlocking the knee. And this tendon actually can cause pain if we have an injury, and it can get tendinopathy or even little tears in it. For all intents and purposes, this this popliteus tendon looks pretty darn good. And if I turn the probe, I can actually then see the popliteus tendon as it comes from behind the knee over here and comes and attaches onto the bone, and it looks really pretty. So back to this view of the eye of popliteus. It sounds like some kind of Harry Potter character or something. But the eye of popliteus right there, and this right here is actually where your LCL is coming and attaching. The LCL is your lateral collateral ligament, and as I turn my probe gently, you're going to see that LCL come into view like so. So this line now that we have going across is the LCL or lateral collateral ligament. And this is one of the major stabilizing ligaments of the knee, and it's on the outside of the knee. This guy can get sprained in certain situations. It goes all the way down and attaches onto the fibula, which is a part of the lower leg right here. Let me get some more gel here. So this LCL can get injured if you're doing something and your knee kind of suddenly bows outwards. That LCL can get injured. It can get sprained or pulled, and certainly can cause pain. But this is, again, a textbook example of an LCL coming all the way across and attaching onto the fibula here. Now, the other thing that attaches onto the fibula is the biceps tendon that comes from the thigh muscles over here. And here is an example of the biceps tendon now coming across here. Now, you could straighten out your knee. The other structures, when you talk about pain on the outside of the knee, we think of things like the lateral meniscus. So the lateral meniscus is the shock absorber between the thigh bone and the lower leg bone. The lateral meniscus and the medial meniscus on the inside of the knee are like the shocks in our car. And again, as we get older in general, these shocks start to wear out over time, and we get degenerative tears, which are, again, completely normal and do not necessarily equal pain. But when we have sudden twisting injuries and things along those lines, we can get tears inside that meniscus. This is actually the meniscus right here. So This is the thigh bone, the femur. This is the lower leg bone, the tibia. And this triangle-shaped structure right here is the meniscus. Actually looks really good. Okay. So now we're going to go to the inside of the knee and look at a couple different structures there. Now, two structures that I'm going to look at on the inside of the knee are the MCL, or the medial collateral ligament over there, and we're going to look at the medial meniscus. So when we look at the inside of the knee here, we're going to see from the thigh bone, the femur, going across the top all the way down to the lower leg is this line that we see called the medial collateral ligament, or the MCL. And this is a line that goes all the way across. Now, in between the thigh bone and the lower leg bone is where we have the medial meniscus. So the thigh bone here, lower leg bone here, and here is the medial meniscus. Okay. And I see a little bit of some schmutz going on in there. Can't say for certain if there is a little bit of some sprain or tear in that meniscus going on. Lex, do you have pain on this side of the knee?
Every now and then.
Every now and then. So maybe there's a little bit of something going on here. See, there's a little bit of black that we see inside there. A little different than what we saw on the other side. So this may have been a little injury that occurred in the meniscus on this side. Again, every now and then. So it's not a constant pain. It's not something that has to be painful. Other parts of the meniscus actually look really, really good. Okay. I'm going to show you a little bit of something. Let's see if I can do this. There's ways for us to look at structures like the meniscus dynamically. So we can look at that meniscus as we put the knee into different positions, and that could actually give us a gauge on if that meniscus is loose or if it's unstable, or even if it's causing pain. So do me a favor and lay down on your side facing this way. So what we can do is look at this meniscus as we put the knee into different positions. So I'm going to try to do this, and I'm going to grab a hold of this leg and relax this leg nice and loose. And as I bring this knee into different positions, we can take a look and see how that meniscus is moving. So if you can picture this area between the two bones where that meniscus is that I identified before, you can see it kind of coming in and out as I move the knee. Now, this is coming in and out in pretty decent, pretty normal amount. It's normal for the meniscus to move a little bit. But if there was a major tear, root tear of the meniscus or something that was causing instability, then you'd actually see this meniscus come in and out substantially more. But this is just one example of how we can use ultrasound dynamically to see what's going on in the knee, which is vastly different than looking at a knee with a static image like an MRI. Let's see. We can look at some other structures. There's stuff on the back of the knee that we can look at, such as like a Baker cyst where a pocket of inflammation takes place, but I don't anticipate seeing a Baker cyst on you, so really wouldn't be worth it for us to really scan here. But there is something we can actually see a piece of the ACL, or part of the deeper ligaments. So get back on your back and bend your knee as much as you can actually. Keep this one. So if we look at the front of the knee, you might be able to take a look with this guy here. Now we'll change our probe. There we go. So when we look over here, looking at the front of the knee, this is the kneecap here, this is the lower leg bone. And when we're looking really deep inside the knee, this structure that you see going in this direction right here is actually part of her ACL. And this ACL connects the lower leg bone all the way to the femur, which is deeper than this. But this line is a piece of the ACL that we see here. And we see that it's going in the right direction. Now what we can't see is how far that ACL goes. So the portion of the ACL that connects to the femur, we are not able to see with an ultrasound, but we can tell from this that it at least exists. So when somebody has a potential ACL injury, this could be a beneficial tool if they don't have a significant amount of swelling and they're able to bend their knee. Then we can actually see, is that ACL still there at all in any way, shape, or form? We could even see sometimes if there's a tear in this part of the ACL or if there's any swelling or issues around that. A little bit more of an advanced maneuver when looking at ultrasound. But there's a lot of different structures. There's structures that I did not point out, but overall, there's a lot of different things that we can look at with ultrasound. It has a lot of potential benefit in looking at superficial structures, tendon injuries, ligament injuries, getting hints at what's going on inside of the knee with cartilage injuries and inflammation inside the knee. But there are limitations. You know, we can't see some of the depth of the joint. Some things like the deep portions of the meniscus, if there's tears that are deep inside the knee, we're not going to be able to see that with the ultrasound. But if we combine ultrasound with a thorough physical examination and listening to the patient and figuring out, what was it that caused the pain in the first place, we're often able to make a really solid diagnosis with a combination of things. So I hope that all made sense. Hope you were able to actually see everything. If you weren't, I'll look at the video and we'll retape it again. We'll see what happens. But if you like this, then again, please share it, like it, subscribe, all that fun stuff. And if you have any thoughts on this video, what we did today, or if you have any other things that you're interested in us talking about, then please let me know. You can email us at info@fxregencenter.com or comment below. We are going to be talking a lot about knee this month, and later on in the month we're going to also do some exercises, some simple exercises that you could do for your knee pain. So hit me up if you have any questions. Otherwise, have a great weekend, and we will see you next week.